point, Steph, I'll take a long sip of water and I will hand over to you to take us through to questions, please.
The first question is around when will this start to feel real with the assessment framework, with our oversight of local authority assurance and systems?
Thanks, Latoya. Rob, can I come to you first for that, please?
Thank you, Kate, and good morning, everyone. So for our work with systems, so when we're going to start to assess integrated care systems and local authorities, that will commence from April 2023. So between now and then, we are doing, like you said, Kate, we're doing lots of work with a whole range of different colleagues and partners across the system. So we're working very closely with the Local Government Association, the Department of Health and Social Care, the Association of Directors of Adult Social Services, and a whole range of different other stakeholders as well, including providers and the voluntary community sector as well. So what we will be doing is we're going to be doing some piloting over the next couple of months as well, to really start to think about our methodology for when we regulate the integrated care systems and local authority, and working with particular local authorities and integrated care systems so that we can really test out whether that methodology is going to work. So it will come into place from April 2023.
Thank you, Rob. What have we got next, Latoya?
Thanks, Rob. Thanks, Kate. So the next question is around inspections and our prioritisation of inspections. So lots of people asking, when will we start getting re-rated from RI to good? And what about our outstanding providers? When will they start to be rated to confirm that rating is still current or still applicable?
Thanks, Latoya. Sue, do you want to have a go at that one?
Yes, good morning. So while we are still working with our current methodology, we are, as Kate has already described, starting to really think carefully about how we re-rate services. And that's not just services that are requires improvement or indeed inadequate. We also want to look to good and outstanding services as well, so that we've got a real mixture of services and a real balance of services across all of the quality indicators. It's quite difficult to give timescales on that, because obviously we're having to prioritise all the time, depending on the information that is coming in, depending on the risk that might be in a particular area. But we are committed to making sure that we start to do that immediately. And so we are already starting to think about how we can use every opportunity of crossing the threshold to assess and to review and re-rate the service.
Thanks, Sue. What have we got next, Latoya?
And just to carry on the theme of inspections, are the CLOEs, so the key lines of inquiries, are they still valid, and when will we start to transition into the assessment framework?
Okay, thanks. Dave, do you want to go for that one?
Sure. So as Sue said, we're still using the existing model through to probably April of next year. So they are still valid. And what we'll do is, to help you understand the transition, we'll set out how those key lines of inquiry have been morphed and developed into the quality statements and into the evidence categories that Kate talked about. So it'll be clear to you as to how that alignment works. And I think an important point to make is stepping into this new approach doesn't mean we have to go out and do a whole program of comprehensive assessment to start again. We're very much building on what we've been doing. It's just we're trying to do things in a much clearer, more transparent and more consistent way. So April of next year is the kind of the date we're working to start to roll out the new model.
Thanks, Dave. What have we got next, Latoya?
And just so we've had a few questions about our monitoring approach, and kind of wanting to be a bit more clearer about what that consists of, and kind of will the focus always be on kind of the digital inspections, or will providers start to feel a bit more of that kind of on-site and being able to show the improvements that have been made with the inspectors?
Yeah, so I hope, as I conveyed during the presentation, on-site inspection observation will remain a really critical tool of ours, but we want to supplement that with much more updated information that we receive from people who get in touch with us. I'm casting my eyes through some of the comments and things such as someone asked about how do we work with local authority quality teams. Well, that is useful intelligence we need to be using. How do we use information we get from Give Feedback on Care to inform our view of quality and risk, etc. So there are a huge number of sources that give us information about services, and we want to have the ability to provide that updated view to providers and to the public much more rapidly than we do now. But on-site inspection remains a really key part of how we will work going forward.
Thanks, Kate. And then one of the most liked questions is a three-parter, so I'll take it in bits as we go along. Sorry. So the first part of the question is, what has CQC learned over the last 2 years of the pandemic, and how will you put it into practice going forward?
Okay, that's a big one. I think we've all learned a huge amount. I don't think anyone who's been through the last 2 years hasn't learned personally, professionally, learned different ways of how we run our respective businesses. So I think we have learned that there are ways that we can work that don't need us to be on site, while noting that there will always be a critical role for that. So one of the ways we adapted our way of working through the pandemic is we work with the UK, or it was the UK Home Care Association, it's now the Home Care Association, to pilot whether we could form a view of quality and risk for people receiving home care without visiting their office. So instead of my inspectors travelling to an office that could be, you know, somewhere on an industrial estate, what if they spent that time having Zoom team calls, speaking with people who receive care in their own homes, speaking with staff virtually, and that we were all, I think we all went into it. I think our natural starting point is we want to see things in person. I think particularly for home care, we as home care providers and inspectors grew confident that in those circumstances, in a lot of cases, we could seek that assurance without spending time in an office. So I think we learned what we could do, how we could review policies, how we could be assured on a whole wealth of things that meant that when we visited a place, we spent that time talking to people, talking to staff, observing care, rather than visiting a place to spend, you know, an hour or two sat in an office flicking through files. I think that probably, there's many things I could say, but that might be the main thing I'd say, Latoya.
Thanks, Kate. So the next one, and this one relates to a lot of other questions that have been asked, is around staffing. Obviously, there's massive significant issues around staffing across all health and social care, but how are CQC going to take this into consideration when going out to on-site inspections and during our monitoring calls and other observations?
So if I can just briefly talk about what we are doing in terms of highlighting the issue of staffing, and then either Rob or Sue, if we could talk about what that means for how we make judgments. So we are acutely aware of I mean, it's been an issue for forever, but particularly through the pandemic, the increasing challenge around recruitment and retention. And we have been publishing monthly updates. So care home providers have been submitting provider information returns, and we've been able to show that back in April of last year, vacancy rates in care homes were at 6%. They're now at 11.5%. So we've been able to share that. We've also been able to share the information. We have the notifications in which staffing issues impact on the quality of care delivered, and that can be in any setting. And we were able to demonstrate, particularly in November and December and January, and it's kind of settled a bit back down now, how there was a significant increase in workforce affecting providers' ability to provide continuity of care. And then finally, we've been looking at when providers exit the market, be that any social care provider, and we've been asking them what has prompted their leaving the sector. And people might think money would be number one, but actually those conversations to date have been showing that workforce has been pipping money as the main reason that providers are no longer able to stay delivering care. And again, our interest in that. So we have two areas of interest in particular in workforce, which is one, how workforce impacts on quality, and two, how workforce impacts on the stability as a sector. So Rob, do you want to talk a bit about workforce and when we go out and inspect?
Yeah, happy. Okay,
Don't mind. Go on, Rob.
Yes, no, I was just going to say that, you know, it's really important that we understand the context that providers are working in and the extreme difficulties with workforce, and it is a huge challenge. As you've said, Kate, we always need to think about what this means for people and the impact upon their care. So that's ultimately our primary responsibility, to think about how people are being supported. So we always need to consider that. However, we always do need to think about the real difficult circumstances that providers are working in, and we do take that into account. It's just really important that if providers are struggling, that they speak to CQC, so they speak to their inspector, they let us know, and that they tell us about what plans they're putting in place to try and resolve issues, how they're seeking support from the local authority and from other partner agencies that may be able to support as well. That's really important. And how they can perhaps work with other providers as well when there are particular difficulties as well. I think that's really important. But I think the important thing is that the key points for me is we always focus on what's in the best interest of people and what the impact is on them. We are very sensitive to what the issues are, but keep us updated if there's particular issues.
Thanks, Rob. What have we got next, Latoya?
Thanks, Rob. So just another bit of a two-parter around local authorities and their ability to kind of understand and commission care. So the first part of the question is what do we envision is going to be kind of our approach to making sure that local authorities deliver a fair cost of care and in that way, like increasing fees? How are we going to support with that so that providers are able to deliver high quality care?
Okay, that's either a Rob or a Dave. Who would like to go first?
I don't mind, Dave. Do you want me to, or do you want to go first? It's entirely up to you.
You can go if you like. You got the cons.
Thank you. Thanks, Dave. I mean, this will be absolutely something that we will look at. So when we start to do our assessments, we will be looking at commissioning and leadership. That's the two go hand in hand. So we'll be looking at, and I've seen some other questions that have popped up. So how providers will be supported. So we will be looking at what the current commissioning arrangements are in place, but also thinking about how the local authority is working with other partners as well, to really think about what the needs of people in their local area are, what the needs are of particular people from different communities. How are they developing and shaping services at this moment in time, but also how are they thinking about how perhaps their demographics and their population needs are going to change over a given period of time, and what are they thinking about for the future as well, and really how they're involving people who use services, working with providers, working with all of the other partner agencies to really think about, well, what is the range of support that is being provided to people and what do we need to develop in the future. And then in terms of the charging reform, I mean, that is certainly something that we will be looking at. We will be able to make any decisions or say to the local authorities, you must do this. But what we will be able to do, and this is really important in our independent voice role, we will be in the unique position that once we start to do those assessments of the local authorities, we'll be able to see what's happening both in regional areas and national areas, and we'll be able to report on that back to Parliament, so that feedback from providers and from other partner agencies around those issues are really being reported back and then can hopefully be acted upon. Don't know whether there's anything, Dave, you wanted to add to that?
No, thanks, Rob. That was really comprehensive, I think. Thank you.
Thanks, Rob. And that's actually covered the second part of the question I was going to ask. But also just to carry on in terms of local authorities, how are we going to prepare our inspectors to be able to kind of go into a local authority and inspect and assess the right things? And then how are we going to convey that to the public and providers?
Thank you. That's a great question, and that's actually something that we're working on at this very moment in time. So So we're starting to think. So as we've said, we're starting this in just over a year's time, in April 23, and we're already starting to think about, well, what teams do we need in place? Who from CQC will be involved in this work? And it won't just be inspectors, it will be a range of colleagues as well. So it'll be our policy colleagues, it will be our analysts, and they will all need to have specific skills. So we're already starting to think about what training and development needs our colleagues will have, and we will be certainly working on that as we approach April 2023. We're already working with some sector specialists. So we have a senior advisor, so a man called Paul Nazaric, and up until very recently, he was the chief executive of Ealing Council, and he's working with us, and we're really using his wealth of knowledge around how we can really understand what the contemporary issues are within that local authorities are grappling with, and how we can then bring that into our training and development of colleagues. And we're also thinking about, when we get to the point when we start the assessments in April 23, how we can use external specialists as well. So people who already, for example, work in local authorities, how they can work with us along and be part of our team, so that we've got CQC people involved, but also those external specialists, so that we've got it all fully covered.
Thanks, Rob. So the next question is going to be around systems. This person is particularly asked around discharge processes, but I think from a wider perspective, how would the adult social care voice be kind of heard in the integrated care systems processes that we're going to go, the oversight powers that we potentially have? And this person, so they've asked around discharge processes and how that would be reflected in people's writing choices. So, yeah.
I'm happy to answer that one as well. Again, a really great question, so thank you for that. And I think it's just really important, when Kate was talking about the system work that we're going to be doing, the local authorities will actually be part of the integrated care systems as well. So it's really, they are very interdependent on each other. So when we look to do our local authority assurance work, we will be very much thinking about, well, how are they working with providers? How are they working with NHS colleagues? What are the key issues within that particular area? And we all know that hospital discharge and throughput through a hospital is a key issue. So that is absolutely something that we will be looking at. But we'll also look at it when we're actually doing those assessments. But we're also sitting on a goldmine of information in CQC as well. So we do all of the inspections of the hospital trusts, of all of the adult social care locations, of all of the GP practices, and within as we're developing our methodology, and as Kate has talked about, really starting to think about how people are receiving support across all of the different services, we'll use the information and intelligence the care home providers are telling them where there's issues, and we'll be able to really focus on that when we look at those inspections. So really great questions, but will be absolutely something that we'll be looking at.
Thanks, Rob. And moving kind of back to our current practices around inspections and the processes from start to finish when you're newly registering, how would the experience be changing for people that have just newly registered with CQC? But also currently at the moment, what work are we doing to address kind of people that have newly registered as a provider with the service, and kind of them getting inspected for the first time or re-inspected? So maybe one for Sue and Dave.
Yeah, Sue, do you want to come in?
Yeah, of course. So we absolutely recognise the importance of rating services that have not yet had a rating, and we know that's really important. And it was something that we were not able to do as frequently as we wanted to do during the pandemic. So it is part of our priorities at this very moment in time, as I say, using the current methodology. Again, with other types of services, we have to risk assess and prioritise within an area. And for example, a service that has been registered but not been rated for longer is going to have an inspection sooner. So we're obviously going to give that priority. And we would also give priority to a service maybe that has not had a rating, and maybe we've had information of concern. But absolutely, we see unrated services as a real priority for us to get out, to undertake a comprehensive inspection, and that's again, using the current methodology to make sure they get a rating as soon as possible.
And if I could just add to that, in terms of the future model, we recognise there's currently a bit of a gap between new registration and rating and assessment, and we definitely want to close that gap. So what we are doing through the single assessment framework, through really clear evidence requirements that Kate set out, we can actually start building that assessment from registration. So that if we've looked at policies and procedures on registration, we don't necessarily need to then go and look at them again in order to start building that rating. We've done that work. The teams have been much more closely aligned. So actually we can build on that from that first point of registration right through to the actual confirmation of the rating. So we're actually getting a head start really on that work as part of the future model.
Thanks, Dave. I'm thinking, Latoya, we've maybe got time for one or two more questions.
Yes, definitely. I think so. The next, I guess, question or two will be around our current practices and reducing burden on providers. We've had a lot of questions kind of asking to address the stresses that providers are under at the moment. And they want to know what efforts CQC are making to kind of reduce burden on, I guess, submitting information, data, or just generally how we're going to maybe be approaching and be more understanding of their current situation.
Okay, who wants to kick off with that? I've seen a few questions about provider information returns and whatnot. I mean, our whole ambition is to make sure we use all the information that's available as effectively as possible, and that you're not asked to duplicate information. But I see from the comments in the chat there is frustration about that. Does anyone want to talk? Dave, do you want to talk a bit about what it might look like in terms of how we use data that providers give us in a way?
Yes,
that isn't
certainly. I mean, and first off, that was the original inspiration really for the single assessment framework, recognising that providers are commissioned by different authorities, might have need to share the same information slightly differently for different audiences. So we're really trying to convene the whole health and social care sector into one shared space here, so that actually we can collect once and share many times. And absolutely, what we're trying to do through our through the enhancements we're looking to make through the way that our processes work, but also the way that our IT works, is actually it will feel much more like a smooth running service for providers. And service is a word that I definitely want to emphasize there. That is the approach that we're doing. We're looking at how can we develop our registration service, how can we develop our assessment service so that it is easy. As a byproduct of just you doing what you're doing as providers, actually we can access the information that we need, and in a way that is easy for you to share. Part of that will be how can we essentially lift information out of digital care management systems, which around about 1/3 of social care providers are currently using. That would lift, we think, quite a lot of burden from providers. We can actually just get that insight from those systems, but we also want to look at other ways, and really keen to get any other ideas from you as to how we can streamline and really kind of reduce that regulatory burden wherever we can.
Thanks, David. Is there one more, Latoya, and then I'll wrap this up if that's okay?
Yes, so save the best to last, hopefully, ending on a bit of a positive note. How will CQC promote and celebrate innovation?
So the fact that we have one of our 4 pillars around accelerating improvement, I hope indicates our ambition to really highlight best practice and encourage other providers to adopt that. What's been tough for everyone over the last years, many things, but one of the things is the focus on risk and the need to get out to services that we're worried about. We want to move back to a much more variety, where we can also be getting out to outstanding homes, to homes that are confident that we would find outstanding practice if our inspectors went out and spent a bit of time with them. And we want to do that because our strategic goal is about driving improvement and looking at innovation, and we can only do that if we're seeing it and publicising it so that best practice can also be shared. So watch this space. I am really hopeful that in the coming months there will be an increasing emphasis on re-rating, but also getting back out there to look at the wealth of best practice that is also happening whilst providers are juggling a huge amount of kind of turmoil and challenges as well. So thank you very much, Latoya, for that really difficult job of juggling 250 questions. And I'm sure there will be people on the call who are frustrated that theirs haven't been answered. But you've done a great job at drawing out the ones, I think, with most likes and ones grouping together themes. So thank you so much for your questions and your engagement. As I said at the top of the call, we will be sharing this webinar on our YouTube channel. We will be making the slides available, and there are many ways to get involved if this is, as I say, whetted your appetite and you really want to help us thinking about local authority assurance, or you want to get involved with the pilot for the new single assessment framework for providers or whatnot. So a massive thank you for your time and engagement today. I hope you found it useful. Give us feedback as to how this has landed with you, and we look forward to many more conversations over the next 12 months as we stand up our new approach to regulation from April 23. So at this point we will end the webinar, and I wish you a good rest of your day. Thanks all.